Hello and Assalamu alaikum. Welcome to the series of Psych Learning Wrap-Ups. Today's tutorial is about an introduction to health psychology. We'll be focusing on learning that what is health psychology, what is the history, and what are the benefits of health psychology that may be available to the society. The question is that what is health? How do we define health? What does it mean to be healthy? Is it simply the absence of disease, or there are some other factors or some other conditions that are required to be present, for instance, some positive condition? Over the period of time, the views as well as understanding and meaning of health and disease have evolved. Previously, it was perceived in 1900s that an absence of disease is considered to be health. And the causes of diseases were considered to be contacting impure drinking water or contaminated food or contact with the sick people. There was also one more issue, that was lack of cure available. That is, when the people used to get ill, it was perceived that they would not get better and they would eventually die. And the hospitals were perceived to be places of death. However, in 20th century, there were changes that were brought. The leading causes of death or the diseases changed from infectious diseases to those that were considered to be something related with the behavioral practices and lifestyle of the people. Additively, there was also availability of effective treatments, and health was perceived to be a positive condition. Other than that, with the effective treatment availability, the cost of medical care also increased, which also called upon education of the people regarding the health related behavior, which may lower down the risk of ill health. And now in 21st century, we find that people are much concerned regarding their own health, their lifestyles, and there is a concept of health which is pretty different from something in 1900. Now, health is defined as presence of positive well-being, not merely the absence of disease. Advocacy of broader perspective of health have been there. The focus has now shifted from biomedical model to biopsychosocial model that focuses on biological, social, and psychological aspects of health. Similarly, there has been change in the patterns of disease and death. Most of the problems and diseases are attributable to the behavioral practices and lifestyle. The common found diseases are heart diseases, cancer, stroke, chronic lower respiratory diseases, unintentional injuries, and diabetes. For example, unintentional injuries that may be related to the accidents, which may be the car accidents, or for example, we have been hearing about different unintentional killings, and similarly indulgence in risky behaviors like teenagers, they indulge into behavior of risk-taking activities, for example riding a bike on a very high speed, which may lead to some sort of injury or even death. When we take a closer look at the current trends of the illnesses or mortalities, we again find that the diseases are associated with the individual behaviors and lifestyle. The diseases related to heart, stroke, and motor vehicles and other intentional injuries are common as discussed. However, there are many other diseases which are becoming more and more common, uh, but they have something less to do with the behavioral components, or probably more research is required to know about that there may be some kind of behavioral components attached to them. For example, Alzheimer's disease or Parkinson's disease. Life expectancy and mortality have modified and it has changed. There are various factors that are connected with that. First thing, as discussed, is the behavioral perspective, and the other is age related trends. In the 21st century, we find that homicide and unintentional injuries are mostly related with the youngsters because of their indulgence in risk taking activities. However, older people generally experience diseases which are related to cardiovascular activities. Similarly, we also find that suicide is also more common in age bracket that is from 15 to 30 years of age. With reference to life expectancy, we can also say that over the period of time, the life expectancy has increased. The average life expectancy globally is 66.6. However, for females it is 67.5 and for males it is 65.5%. Another factor is or factors are ethnicity, income and disease, which are closely related to each other. It is said that there are certain ethnic groups which have specific educational experiences, or you can say that they are some extent having more exposure and they have more resources to get education. Similarly, when they have greater education, there are more chances of having those jobs that are high paying, so they maintain their income level. For example, if we compare the European Americans, they live below the poverty level, whereas 24% of the African Americans and 21% Hispanic Americans. So we just find that these disadvantages in terms of poverty or in terms of low education or income, they have an influence on the health related activities of the individual. Because of the reason that uh, it is more convenient for those who are earning good that they can send their children to school, then they once individual has gained education level, so it is more convenient for them to get good paying jobs. However, those who are not educated, who are illiterate, they tend to go for the lower skilled jobs. Connecting psychology and health, we see that a large part of psychology's involvement in healthcare is a commitment to keeping people healthy rather than just waiting to treat them after they become ill. So, when we see that how health and psychology become connected with each other, we can trace back the emergence of behavioral medicine that came into existence in 1977 when a conference was held at Yale University. They defined that the interdisciplinary field concerned with development and integration of behavioral and biomedical science knowledge and techniques relevant to health and illness, and application of this knowledge and these techniques to prevent, diagnosis, treatment, and rehabilitation. So we find three components of that. Firstly, that there is integration of behavioral and biomedical science knowledge. Second, the techniques which are present or which are related to health or diseases, they should be connected. And thirdly, the techniques which are used for prevention, diagnosis, treatment, and rehabilitation, they all should be amalgamated together. So we see an integration of medicine and psychology. The target is simply to prevent, diagnose, treat, and rehabilitate. Health psychology is a branch of psychology that concerns individual behaviors and lifestyles affecting a person's physical health. It focuses on modifying the behaviors involved with physiological and psychological rehab, also to identify conditions that affect health, as well as application of psychological principles to physical health. So we see that health psychology basically focuses on enhancement of health, prevention, diagnosis, and treatment of disease, includingly identification of health-related risk factors, improvement of healthcare systems, as well as shaping public opinions as well as behaviors with regards to health. Let's take a look at the brief history of health psychology. Overall, the psychologists assess, diagnose, and treat the psychological problems and behavioral dysfunctions resulting from or sometimes relating to the physical and mental health. They play a major role in promotion of health behavior, preventing the diseases and improving the patient's quality of life. However, we find that here there is very lesser scope, and it is not much known that a psychologist can serve as a health psychologist. So there is a dire need to understand the role of psychologists in medical health care, and by that we may be able to enhance the scope of psychology. Health psychologists use the science of psychology to promote health, prevent illness, and improve health care. And that is what we have been doing in different fields of psychology connected with health. Let's take a look at the history because it has been so many years that health psychology actually became a unique profession. We can trace back that in 1973, American Psychological Association set up a task force for understanding and exploring the role of psychology in health. The task force took around 3 years to submit their report, and they found during their report building that there was a lot of research that was being conducted in the area of health and medical science that was related with psychology. How it was unreported, and because of the reason that there was no separate journal of health psychology, so such researches were not published. This report actually envisioned a future for health psychology, which actually helped in enhancement of health and prevention of disease. In 1978, American Psychological Association established Division 38 that was labeled Health Psychology. It was defined to be a scientific, educational, and professional organization for psychologists interested in the areas that have the interfaces of medicine and psychology combined. In 1982, as the research was being conducted, health psychology maintained a status of a separate profession, so a journal of health psychology was launched. Over the years, it took a lot to health psychology to become or emerge as a unique profession. And as mentioned throughout this uh, history, that it actually met 6 criteria for establishing a separate profession. That was starting from the task force, from starting from developing its own association, then journal were published. After that, there was acknowledgement from professionals in other fields of psychology. Then postdoctoral training also began in the field of health psychology. There was recognition from American Board of Professional Psychology, American Psychological Association Commission on recognition of specialties and proficiencies in the professional psychology. So we find that health psychology um, has been uh, endeavoring to become recognized, and now it is much recognized within the medical schools, schools of public health, universities, and hospitals. It took a lot of years for health psychology to become a unique profession.